Hello everybody, I'm Precious Edem, a student from the Department of Microbiology, University of Uyo. I'm here to brief us on my research, which is titled The Bacteriology of Postsurgical Wounds and Their Sources of Infection in Some Public Hospitals in Akwa Ibom State. Bacteriology is a branch of microbiology that deals with the study of bacteria, where post-surgical wounds are incisions or tissue injuries created during surgical procedures. Now, the bacteriology of post-surgical wounds will provide valuable insights into the type of bacteria that causes a particular post-surgical infection and their prevalence in the hospital. The infection of post-surgical wounds can arise from several factors which are grouped into two factors. The first one is exogenous sources. Exogenous sources include the hospital environment, the medical personnel, etc. The second source is endogenous sources. These endogenous sources include the patient's skin flora. Secondly, the patient's health condition. This research will help in improving prevention strategies and guiding of antibiotic use. The objectives of this research include: first, to isolate and identify the bacteria responsible for a particular wound infection. 2. To identify the prevalence of this bacteria in public hospitals in Akwa Ibom State. 3. Will be to identify the sources of the post-surgical site infection. The fourth objective of this research will be to identify the antibiotic susceptibility patterns of the bacteria that will be isolated from the wound samples. Now, the methods I will be using for this research will be strictly microbiological method. First, I'll need to identify my sample area, which will be public hospitals in Akwa Ibom State. Secondly, I'll need to identify my sample population, which will be adults who have received a surgery, a particular type of surgery, and have sustained an injury, probably during the surgery or after the surgery. Then, after that, our collection will be done in an aseptic condition under the approval, the consent of the patients. Also, after the collection of the samples, I will transport every sample to the lab and carry out microbiological tests to include gram staining, biochemical tests such as indole test, oxidase test, citrate test, coagulase test, sugar fermentation test, etc. Also, I will perform an antibiotic susceptibility test on each of these bacterial isolates that will be identified from the samples. Ethical approval from the UNIO Research Committee and Akwa Ibom State Ethical Research Committee. This research will be so much insightful, and I can't wait to learn from it, because I will learn from it. Thank you.